Doctor's practice hapa ni Hill Park Hotel. Kabla turudie discussion tena, tuweze kujua exactly nini inafanyika when somebody is being treated or has gone through treatment ya TB. Here's how.
My name is Stephen Anguva Shikoli. I'm a TB champion. I'm the director of Pamoja TB Group, also the national coordinator network of TB Champions Kenya. I suffered TB in 2009. I started having pains in my body, chest pain, coughing in January 2009. But I didn't realize it was TB because I had no information on tuberculosis. But when it came to around May, was the time when a friend of mine told me that you might be having TB. It's good to go for a TB test. So I went in June. I went at Westlands Health Center for testing. So when I was tested, the results came out to be positive. So I was told I have to go to Kangemi Health Center and start medication because that is my area of locality. I was given treatment for 1 day because it was in the afternoon. And I was told, now you need to come with somebody that will take care of you, a treatment supporter. So my mother said, okay, we will come. You see the way she was good, she said, I will take you. Unfortunately, she just came in to show that she's there. But after that, she told me that now I'm not going to stay with you. You have been bewitched. This is not a normal disease. This disease has never been into our family, so I don't want to stay with you. I was taken back to our rural area, but I refused. So I came back to Nairobi. I came and I told the friend that advised me to go for a TB test. Now that you are the one who advised me to go for a test, the results are here. My family don't want me. So what I will do, I will stay with you. That's how I continued with medication. But because of that lack of good support, because this guy was working during the night. In the night I was staying alone, coughing. Up to the neighbors were saying, you guy, you are coughing like a drum. Every now and then, because I was coughing, spitting out blood. It was not good. I continued taking treatment at month 3. That is around August 2009. It's when I started picking up. And because of the support that I was given by the community health volunteers around, I decided to start a psychosocial support group that's called Pamoja TB Group. We started as a self-help group where we share experience with people that are on treatment and those that are continuing and those that are almost finishing, to encourage each other to adhere to treatment and to see that support. I usually advocate for people or facilities to have support groups. We have seen students that teachers come, they say they will support them, but they don't support them, which leads to stigma and discrimination in the community. So this stigma that pushed me to start Pamoja TB Group is the stigma that I don't want anybody suffering from TB or any other disease to face in our community. Being a champion, I think I've achieved a lot. 1, I've achieved a responsibility in my health. 2, there is that acceptance of my community. Because now I can stand in my community and say, let's go this way, and people go. I can empower more people. And another achievement is that I've been recognized by the National TB Program, where I now sit at the TB ICC. That is a health sector working group that we discuss issues to do with policy when it comes to TB to ensure that community engagement is factored in. Recently, I won this award, which is a Heroes Award, PEFA Heroes Award in 2020. This is given to very few people, and it was for outstanding work that we do, coming together with my group and ensuring that the gains that have been made toward TB are not going to waste during this time of Corona, because we have been taking medication to our people that are having TB. If somebody is out there and they are wondering, what will I do after TB? Advocate, be a champion, and God will pay you.
This is Hill Park Hotel, showing it to Doctor's Practice. Ade, Stevo, Saimo, Roda na mimi tuko ile tunazungumzia mambo ya TB. Nakumbuka the theme this year is the clock is ticking. Ni muhimu usikize especially vile Steve na Roda wanazungumzia, kuna kitu sawa umesema about treatment buddies in terms of kusaidiana, manake a lot of things that happen na hii ugonjwa ni inafika point tunachoka.
Yes.
So unataka jamaa mbaya nakwambia hapana, wewe kuja, wewe wacha mchezo, kuja tusaidiane in terms of treatment. So tuanze na wewe Simon.
Kabisa Jim.
Na hiyo na treatment imechange over the years.
Imechange quite a bit. From the 80s and 90s where ulikuwa ukidefault on TB treatment, you are liable for imprisonment.
Ati?
Yes. Ulikuwa unashikwa na chief anakam na MAP wanakubamba, unaikuwa ndani, una sababu wanasema you are a risk to the general population in terms of public health. So hiyo ni kitu ilifanya hata stigma ya TB rise sana.
Oh, okay.
Because watu walikuwa wanaona kama ni disease for, you know, ukipata mazee uko
umevunja sheria.
You are like the down and under. But over time it may change. Human rights you know, laws have come in and just looking at it at a humane level. So tuna encourage patient akisha diagnosiwa tunamwambia hii ni dawa ni important tumalize. Now in terms of the drugs, tulianza in the early days we used to use injectables.
Yes.
So patient ilikuwa inabidi kuje hosi. So over time tuka transition to oral medication.
Okay.
Oral medication also came with its challenges. Vile nilikuwa nimesema pill burden. Tukaendelea sasa kukuwa na better oral medication, fixed dose combinations. And then now as we went along, we also now began to know what are the main adverse effects ama reactions ama side effects zenye tunaweza look out for. So tuna monitor patients on a very regular basis. The first 2 months nakuja weekly. So tuna monitor especially liver function tests because kuna drugs in affect liver. Tuna monitor your eyes, kuna drug in affect your visual, you know, function. Na tuna monitor pia one of the common issues ni nerve issues. Unapata kuna side effect ya peripheral neuropathy. Unasikia ni kama uko na tingling sensations kwa miguu, kwa mikono.
Na kuna sijui zangilia tu sijui urine yangu ni orange,
hiyo pia.
Sikunywi hii dawa.
Okay. So tunamwambia by the way, ukiona urine imechange si ati ni uchawi. Ni dawa lakini mwili ita adapt.
Usipanika tu.
So then now we couple that with the treatment buddies. Okay? Sasa kikuja na
hiyo kitu treatment buddy.
Namsaidia, anamwambia vile ata expect. So akikuja hosi na mimi nimwambie pia anasema nani pia alikuwa ameniambia hivyo. So ni normal anajua ni normal and everything. But ule mwenye sasa atakuwa na extreme adverse effects kama especially like the visual impairment, huyo patient atastopiwa kwa hiyo dawa because ikiendelea inakuwa irreversible. So we make sure that we take the patient anapelekwa kwa daktari wa macho aangaliwe alafu tuna change dawa.
Kabla ninge to Steve na Roda. Detriment ya resistance. Useme wacha nisi nasikia fiti wacha ni change. Sasa jamaa kuja imekuwa reinfected. Sasa how bad
can it be? Unaona huyo patient mmoja mwenye tushamtreat on drug susceptible TB medicines. Tumetumia 200k ikafail. Sasa amerudi tumepata kona drug resistant TB. Tunamweka on sasa hiyo 18 month regimen yenye sasa ni between 1 and 2 million. Unaona sasa inakuwa exponential. So pia the pill burden ina increase. Alafu sena lazima akuje daily. Akue directly observed akitumia hiyo dawa. Wengine hata wanakuwa admitted for that entire 18 months based on how they respond.
Steve na Roda. Steve ungeze tu what is saying in terms of cost, especially XDR. Because nataka Roda tuambie nanyo really basically because I want to know that association ni association ya kawaida ama is just for TB. But tuambie in terms of costs ya kutibu TB ambayo sisi wananchi sio sema tu serikali saidia ama tusaidie whatever. What is that cost ambayo we don't know?
TB treatment kwa health centers ni at no cost to the patient. Patient afai kulipa, lakini gava inalipa hizo drugs, inalipa tests, inalipa staff, inalipa rent, stima, inalipa. Na uki put together all those costs
per
patient moja mwenye ni drug susceptible or TB ya kawaida 200 to 300k Kenya shillings.
Mtu moja?
Gava inalipa hiyo. Kina Roda.
Roda si unaandika check ya 200,000 kwa.
And we have about 80,000 patients in the country per year.
Na hiyo so kuna mwingine ambaye anagonga mita.
So na wale nyako MDR inagonga mita 1 million.
Mtu mmoja
kumtibu mpaka aishe. Ikikuwa XDR ndio inaenda kukaribia 2 million huko. Ndio hiyo tumalize tuseme huyo amemaliza treatment. So si ati gava is not
so XDR umesema ni 1
so XDR ni 24 months.
2 years.
24 months minimum.
On a daily.
On a daily. Lazima, So lazima umalize hiyo 24 months. MDR ni 18 months. 18 to 24 months generally. Lakini most patients wataenda hiyo 18 months.
Before tuingie prevention, which I think is our last bit. Ebu niambie association. Ni TB pekee kama nyuka kawaida Roda na siwonywa mnakunywa kawa pamoja in terms of TB? Roda.
Okay, for CHS specifically, they support the ministry in a number of programs. They also have HIV programs. They also have TB is one of the things that they support. So in terms of the scope for the program.
And why?
Okay, one, the reason as to why we are doing this partnership, it's because the cost of handling TB is very high. If it was left to the government alone, maybe we will not be able to. So they are coming in to first train our healthcare workers, because our healthcare workers need to get these updates. As they have mentioned about the change of treatment, this is a new thing that came. The change in diagnosis, this is a new thing that came. So we need to bring our healthcare workers on board. So we request them to support the healthcare workers in such, and that is not very cheap. Think of how many healthcare workers we have. Think of how many days you take for this training. Yes, the other support that they support us in is the sample networking. The gene expert machines that we're talking about are not in all our facilities.
True.
So if I'm coming from that dispensary in the far end of, yes, I need this sample to be transported to a place where there's this machine. So they support us in that. Wow. They also support at the national level. We need to, let's say, develop a policy. We need to develop guidelines, because that's the role of the national government. They come in to support us do this kind of meetings.
Kabla tufunge na allergy insurance, because this last question affects both of you. Prevention,
as we always say, is better than cure. It's much cheaper to prevent.
Of course.
So government imeweka mikakati in place to educate the community, community awareness about ways in which you can reduce your risk of getting TB.
Reduce the risk.
Yes. So some of the things that people are educated about is proper ventilation of your, housing and even offices and places watu wanagather. So utapata
kuna hewa ya kupita.
Kuna hewa ya kupita, utapata hata kwa ma3 siku hizi utapata ka sticker kama yakwa TB na tiba. Make sure your window is open, to increase circulation. Juu hapo kwa mati mmefinyana in crowded places, in churches and what have you, hapo ndio transmission ina happen. Tuna advise tena wa increase, their awareness about sanitation and just general hygiene, just to ensure that you are preventing that particular transmission.
Very quickly, BCG
kwa
nikidungoaga kitu mimi niko poa. Sasa unaniambia siko.
By the way, hiyo imeulizwa sana by the way. Because tunaambiwa BCG ni kinga ya TB, si ndio? Hata kama hapa. Why are we getting the, high burden in our country and yet we are vaccinated? Niseme hivi, vaccines actually work. But vaccines also have a level of coverage. Na daktari atakwambia there are certain individuals who the vaccine will not produce a response or an immunity. So bado zina work. Otherwise tungekuwa mbaya. Yo unasikia hiyo 130,000 tungekuwa in the million. So zina work, but we still have those who are susceptible
Preventative medicine.
and they end up getting it.
Allow me to
Sijui
add
kama
something
ni-
on
eh,
prevention. Okay.
Alafu yatupeleke nyumbani.
Okay, so in addition to what Semo has talked about, kuhusu prevention, there are a number of strategies that the government have also put in place. Dr. Wanjala talked about latent TB. Unakumbuka?
Nakumbuka latent
Tukasema ni
TB.
nini?
Ni ile tu iko ndani. Kila mtu ako nayo lakini hujaiamsha.
Yes. So
Usikiza.
you're doing well.
Usikiza. Firirindi.
So there's another strategy which is also an equal effective way of preventing tuberculosis by targeting that latent TB. So here we are offering what is called TB preventive therapy. This is something that has been in place for some years, specifically for people living with HIV, because we know of their immune status. So today you're diagnosed with HIV, we give you this TB preventive therapy so that in future you don't get tuberculosis.
Oh, wow.
The other group that we have been handling is the children below 5 years who are living with somebody mwenye akona TB ya kifua, pulmonary, what we call pulmonary back to confirmed TB. So wale watoto wanaishi na huyu mgonjwa chini ya miaka 5, wako chini ya miaka 5, wanapewa pia TB preventive therapy. But now we have seen it work. As we're talking about TB, HIV, one of the things that he didn't tell you that our co-infection rate, the patients that we're getting with tuberculosis with HIV has also gone down. Tumetoka mahali ilikuwa about 40% of our TB patients were living with HIV. Right now we're doing at 25%. And that's what Dr. Wanjala was talking about. 3 out of 4 will not be having HIV. So we have seen it working. The other group that we're targeting is healthcare workers. We know healthcare workers are at risk of everything. Mara COVID, forefront. So healthcare workers will be another target group.
Time zote zimeisha na vile mpenda kumalizana na day na voice tamu na story. Lakini ametuambia insurance.
Yes.
Wanjala, thank you. Rhoda, thank you. Clock is ticking. Sasa nimeelewa, clock is ticking. Kama una information, utaumia in anything. Clock is ticking. Say more thanks. Ade? Wewe?